Hello and welcome. I'm Daniel Che coming to you live from the Arirang News Center. We're approaching 11 a.m. local time here in Seoul. We'll be bringing you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing with simultaneous interpretation in English. There will be updates on the number of new infections as of midnight and efforts to contain the virus, especially with continuing cluster infections in Seoul and the surrounding capital region. There have been several days of the coronavirus tally staying in the 1,000 range. Health authorities are expecting the trend to continue for the next few days. The capital city continues to see spiking cases, even after 2 weeks into the stricter level 2.5 measures. Now let's go straight to the venue for the briefing.
First of all, we have Mr. Yoon Tae-ho with a briefing on the COVID-19 situation here in South Korea. Let us now begin our regular briefing for December 25th, Friday. As of today midnight, we have a total of 1,216 new local infections. Yesterday at the makeshift testing sites, we have confirmed a total of 121 people, and especially in the detention center in the Seoul city, we also carried out second massive testings, and additional 288 people have been confirmed there, and we have seen a large increase in the number of tallies here in the metropolitan area, and we had 17 more fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Here are some updates on our quarantine measures. Just yesterday alone, we had over 118,000 tests that have been carried out so far on a daily basis yesterday. And we also have many people, 57,000 people testing with symptoms. And also in the temporary screening sites in the metropolitan area, we carried out 60,000 tests. And so far, we have conducted a total of 400,000 test takers here in the metropolitan area. We confirmed a total of 1,025 confirmed cases in the metropolitan area. And here are some updates on our medical capacity. And we are also decreasing those people who are on a delay until they are admitted to the hospital. And we are continuously decreasing the number of people who are waiting to be administered to the hospital, and a total of 170 people are waiting to go to the hospitals, and we are also aiming to decrease this number to two-digit numbers. And by these people are categorized as people who have light symptoms. However, they need special care because they have other disabilities or other special medical needs. And to this end, in the metropolitan area, we are also designating 3 nursing hospitals and designated hospitals to treat COVID-19 patients, so that we could treat COVID-19 patients who have Alzheimer's or other medical needs. And also, we will provide some medical care, and the mental care health facilities to provide necessary help as well. And yesterday alone, we also had in the Pyeongtaek city, we have 6 people who are going through catalysis because they have liver-related diseases, and this hospital named Page Hospital will also continuously to treat these patients going forward. And starting from this mid-December, we also aim to look into the facilities as for the disabilities, so that we can provide more healthcare services with those who have disabilities. And yesterday we have newly opened life treatment centers that could house 600 patients, and we have secured and we have room for about 6,000 hospital rooms for life treatment centers, and 5,000 rooms in the metropolitan area as well. And currently, as for the designated hospitals, we have about 360 rooms and beds available here in the metropolitan area. And going forward, we will also provide great incentives. About 17 15 billion Korean won will be provided so that we could secure up to 500 hospital beds going forward. And as for these people who have light symptoms and are below the age of 59 who are admitted currently to these hospitals, we will also switch them to life treatment centers to secure more hospital beds. And we will also secure more hospital beds for these critically ill patients. And we are closely cooperating with the public hospitals as well as upper-level hospitals. And we have secured hospital beds as well for the intensive care units. And currently we have about 670 beds nationwide and about 400 beds available in the metropolitan area. And among them, we could utilize 40 in the metropolitan area right now. And despite difficult situations, we also extend our deepest gratitude for everyone for helping us secure these medical facilities. And we will also once again respect and pay our respect and also extend our deepest gratitude to the medical staff members who are exerting their full efforts. We will provide also great subsidies and incentives going forward. And also we will be expanding the health insurance coverage for those who have been confirmed with the virus. And we will also have designated hospitals who have been designated to treat these COVID-19 patients. We will be providing more subsidies for the next 6 months after they are discharged from these designated hospitals. And we will also like to provide great incentives as well as allowances for those who are providing utmost efforts. And currently we have seen many rumors and false news and fake news about COVID-19. And please note that these fake news have a great risk on the public's health and public's security as well. So we would like to take stern measures. And there are also many of these fraud websites that are also disclosed. And also there are fake rumors about elevating the social level distancing to level 3, and thus also in many non-scientifically proven methods of treating COVID-19, for instance, using the salts that are grown in the Ulleungdo area. And we also have reviewed 50 some of these fake news, and we have also put stern measures on about 38 of them. And the police agency will also look into these and investigate into who has made this fake news and also those who have distributed these fake news. And currently we have about 170 cases related to these that have been investigated, and about 273 people have been under investigation. And please note that spreading such false news that could leave great worrisome on the public does not do any good for the public. And please understand and please note that you need to first rely on the credible sources of information that are disclosed by the government. And the quarantine authorities will also take stern measures against these fake news that has been spreading so far. And second, we would also like to provide you some updates on our special quarantine measures for the correctional facilities. We carried out 2 rounds of testings at the detention center in Seoul, and we also confirmed a massive outbreak, including more than 400 people who have been detained there. And we will be currently providing a cohort care for this facility, and we will also treat these patients going forward and treat as those facilities as the life treatment centers. And we have mobilized 9 medical staff members and provided 5,500 equipments and protective equipments. And to this end, the Justice Ministry will look into the 50 correctional facilities nationwide, and we are also exerting our full efforts to intensify quarantine measures. Going forward, all of those who will be newly detained will be tested for COVID-19, and we will also provide 2 to 3 weeks of isolation. And after discharging from isolation, these people will also be tested once again with the PCR testings, and they will also be discharged afterwards. And we will make sure that we take strict quarantine measures so that we do not have another cluster case stemming from correctional facilities. Today is Christmas Day, which is a day that we shall celebrate all together. However, the COVID-19 situation is very serious and very grave. Yesterday and today, many religious facilities have switched these gatherings to non-face-to-face means. We would like to exert our deepest gratitude to all of these religious facilities, and also we would also like to provide everyone for your help and for your cooperation. And we also once again would like to extend our deepest gratitude, and please ask for your continued cooperation going forward as well. And lately we have seen many small cluster infections stemming from small-sized churches. And we ask for you to take particular precautions. And please note that these small churches have higher risks of infection because they are more crowded and confined. And please switch all gatherings to non-face-to-face means, and please do not dine together. Today, we also had the highest level of COVID-19 cases here in South Korea, with more than 1,200 cases nationwide, and also about more than 800 in the metropolitan area. And the non-metropolitan area is also seeing a hiking number of confirmed cases, with about 350 cases. And right now, it is very good that we can contain the virus in our early 1000s. However, we do not see a rapid decline of the cases, which is a great limitation right now we have at hand. And to this end, we have put in place the special year-end holiday quarantine measures until January 3rd. We understand that you will go through many difficulties and inconveniences, but please note that this period of time is very important for the nation. Therefore, we ask for you to try to contain the virus, and also limit and reduce the number of gatherings, and also stay home safe and sound, and comply with the quarantine measures. And we sincerely hope that we will turn around the situation early next year. So please cancel all of your gatherings with your families, friends, or even relatives. And please stay home. In particular, we need to always wear face masks. However, if you do not have a face mask, meeting other people could be very dangerous and very risky. We understand that and please understand that these quarantine measures could be of great help in protecting your neighbors. And please once again go through and review the true meaning of Christmas Day, and we ask for your participation. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다.
Right, that's all we have for you at this hour. As always, thank you for watching.